4, 3, 2. Hello there, Myers on special needs. Welcome to our broadcast. We're very fortunate to have the executive director for the Myositis, Mr. Bob Goldberg. Welcome to the broadcast.
Thank you, Rob. Glad to be here.
Thank you. I'm pleased. I understand that May is Awareness Month, and we're wanting information out on your behalf and be an advocate for the association. So in order to share with folks just exactly what myositis is, share what the types are that are known at this time?
Sure. There are three types of myositis: dermatomyositis, polymyositis, and inclusion body myositis. Dermatomyositis affects the skin, and it usually results in a rash, muscle weakness, and because of other skin manifestations, it's pretty clear that the patient has something wrong with them, and they end up going to see their primary care physician or a specialist. Polymyositis, poly meaning multiple, means that multiple muscle groups are affected, largely the trunk muscles, meaning the neck, the shoulders, the arms. People with polymyositis often discover they have it when they have trouble reaching up and combing their hair or brushing their teeth in the morning. The third form, inclusion body myositis, is different from the other two in that it's a very subtle, slowly progressing disease that creeps up on people. Oftentimes they just dismiss it as they're getting tired or they're getting old, and the more difficulty they have climbing stairs or getting up out of a chair, eventually it gets to the point that they can't get out of a chair or climb stairs, and that's when they realize there's something wrong other than just getting old. That disease affects quadriceps and also the hands and the forearms. Good news is that there are treatments for dermatomyositis and polymyositis. The bad news is that there are not any effective treatments yet for inclusion body myositis.
Okay, very good. Bob, what are the association's goals for the month of awareness here in May? What are you trying to achieve?
Right. Well, because this is a rare disease and affects only 1 out of every 20,000 Americans, most people will never hear the word myositis in their lifetime. Our goal during this month is to celebrate awareness and the importance of creating awareness of this disease. The way we're doing that is through a variety of media, TV, radio, print as well. Some of our members are holding public events. Others are writing letters to their local newspaper editor, calling into a radio station, sharing their experience and the challenges that they encounter with this disease. Hopefully, there'll be some people that hear about it that realize, gee, that muscle weakness that I was experiencing may be more than just me getting old and tired, and they'll go to their physician and get a diagnosis. Diagnosing any rare disease is challenging, particularly an autoimmune disease, and many of our members go to 3, 4, and even 5 doctors before they ever get a correct diagnosis. Oftentimes they get a misdiagnosis and have to go back and see other specialists before they finally realize that it's a rare disease called myositis that they have.
Yes, that's very important, I'm sure, to get there, to get his hand so that he can share these with the diagnostician that's seeing this in his practice. So that's very important. I noticed on the website, Bob, that an indication of KIT groups. What are those?
KIT stands for Keeping in Touch, and those are support groups. We have about 40 of them around the country. Most of the major metropolitan areas have a myositis support group. And just as the name suggests, it's for people to go find others who have their rare disease, have a chance to talk to others about the challenges that they're experiencing and what they've gone through. It's really an opportunity to get emotional support, but also information that's helpful in having people learn how to deal with their disease. There's a lot of learning that goes on at the support groups, and for those who like that sort of thing, it's an invaluable benefit of membership in the Myositis Association.
Excellent. There's discovering of techniques that each individual patient that is useful to see.
Right. Yep. Yeah.
Okay.
There are adaptations that members make in devices that they develop for simple things like buttoning your pants or pulling up your zipper or tying your shoes. These routine, ordinary type of activities. No one ever thinks about them until they lose the use of their hands, and that's where many of our members develop these creative, innovative ways to deal with everyday problems in life.
Yeah, excellent. You know, you mentioned the rarity of the disease and the lack of information in the practitioner's hand. Are there any other issues associated with difficulty in diagnosis?
Well, because myositis can mimic other diseases, there's a definitive test which is known as a muscle biopsy, and that really is the diagnostic technique that'll determine for certain whether you have myositis, because myositis can look to a physician who hasn't seen it before, can look like the person has lupus or multiple sclerosis. So it's a challenge even for well-educated physicians. Many physicians, because of the rarity of the disease, will never see a myositis patient in their lifetime, and when they finally do, they may say, well, that looks like lupus to me, or that looks like MS. So we're trying to create awareness and educating physicians at the same time.
Excellent. In closing, Bob, how can somebody about them and so forth, or the organization itself, find more information?
Well, certainly they can come to our website, which is myositis.org, and there's a wealth of information there. I think between what they find on the website, we have some chat rooms, we have publications, newsletters. Some newsletters are specifically for patients and others specifically for physicians. So there's a lot of education that needs to take place around this disease, and the Myositis Association is leading the way in that area. Okay,
very good. And just as a final note to our audience here, that myositis is there on the lower third, MYOSIT, Bob? The website, MYOSIT. Yes,
yeah, myositis.org.
Let me get. Okay. Well, with that, thank you for sharing the show with me today, Bob. I hope this program gets additional info for you, and thank you for joining. Well, thank you. I appreciate it, and we're very much appreciative of your efforts to help educate the public about this rare disease. Thank you for joining me, Bob. All right. Have a good day. There it goes. Come on. It's having difficulty receiving the shutdown signal. I'll have to to edit the tail of this for you.
Yeah, at the end, I couldn't, it was breaking up multiple times throughout. At the end, I guess you're asking about our website address. I couldn't quite tell what you're asking there, so.
Okay. You sounded crisp to me throughout, so.
Good. Glad to hear it.
Is that a replay? I think we've stopped it, although it's showing that we're still live, and so I've never had this happen to me.
Yeah. Well, we can sit here and talk for the next 4 hours if you like.
No, I don't think
we could launch into sports. Talk about the Raiders leaving Oakland and those sort of things.
Yeah.
Right.
I'll end up having to chop this, but were there any questions that you had at all in respect to the survey that I did Saturday?
No.
I was interested in what the one you thought that there was one difference or so.
Well,
Finally it popped up.
Okay. Let me